Hi, everyone. Hello, hello. Hi, my name's Tallulah Harlick. I'm really happy to be here to talk about all things pigmentation and laser with the wonderful Dr. Anjali Marto, who is here on a full level of expertise on the laser, namely the Hero BBL, which I was fortunate enough to experience how copable it was. But really I want to get into the idea of pigmentation, all of the spectrum of where we have from freckles to melasma, how one treats that, where the laser that Dr. Marto has can really target things in a way that previous lasers haven't been able to kind of counter before.
Okay, so I think if we start with pigmentation in general and what that means. So pigmentation is just an umbrella term. It's not a diagnosis. So there are lots and lots of reasons why one can have pigmentation. So that could be because there is a primary skin condition. So it could be conditions like melasma, for example. It can be post-inflammatory. So you could have an inflammatory skin condition in the skin like eczema, for example, which could leave a little bit of darkening or pigmentation behind. You can also get pigmentation or freckling as a result of simply getting older and sun exposure. So here now, we're not talking about skin disease, we're talking about the natural aging process of the skin. So when one thinks about pigmentation, the first thing you've got to figure out is, what is that pigmentation? Then you work backwards in terms of trying to figure out what the best treatment for it might be. So I guess one of the ways that we could do this is we could talk about sun damage, photo damage, so skin and health. And we could then also talk separately about skin and disease, so skin conditions then that are leading to all of this, if that makes sense. So as we all get older, our skin will change in a very, very predictable manner. What makes young skin look young is, the first thing is the skin's very even in color, it's one tone. But as we get older, we get exposed to more ultraviolet light or sunlight, we start to get more reds and more browns on the skin. So blood vessels in our skin start to become a little bit dilated, we start to get freckling or sunspots, and that happens across all spectrum of skin types that you tend to see. And then there are more predictable changes in a room full of women, and what I'm going to say is you will see an acceleration of this during perimenopause, menopause, quite predictably as well. So there's nothing unusual about getting more reds and browns on the skin. So the laser treatment, well, it's actually a light-based treatment called BBL, broadband light, is one of the methods that you can target photo damage or those reds and browns that develop on the skin. So what does that actually mean? So I'm going to go off on a monologue here unless you interrupt me, but there we go. So broadband light is a form of intense pulsed light technology. So what that means is it uses light energy of lots and lots of different wavelengths, and you fire the light at the skin, and what essentially happens is that light sees certain targets in the skin. So it sees red, it sees hemoglobin in blood vessels, or it sees brown, and it sees melanocytes or pigment cells. And essentially that light energy will either zap that blood vessel, shrink it down. If you shrink that blood vessel down, there's less blood flow through it, skin's going to look less red, or it will fire at the sunspots or the freckling and it will break up those pigment cells. So that's how you end up with the skin looking very, very even in color. Now, there are a lot of IPL or intense pulse light technologies are on the market. So lots of different laser companies will make lots of different devices and they will give them all a different name. So one of the key things that's slightly different about BBL or broadband light is it's one of the few IPL technologies that's also got very good anti-aging data behind it as well. So there was a study that was carried out about 10 years plus ago, and it was published in a very, very good high-impact dermatology journal. So we're not talking about a Mickey Mouse journal, we're talking about the JID, the Journal of Investigative Dermatology. And what they did is they fired BBL at a bunch of over 60-year-olds, and they fired BBL at a bunch of under 30-year-olds. And what they then did is they took biopsies or skin samples from treated and untreated skin, and they analysed those skin samples for nearly 3,000 genes that were associated with skin aging. So collagen isn't the only one, although that's the one that we hear about all the time. And what they actually found was that the over 60s, in their treated area, their gene reversal flipped to match that more of an under 30-year-old. So the additional benefit that you're going to get off a technology like BBL Heroic, BBL Hero versus a standard IPL is, I mean, it's quicker, that's one thing. So if you're treating multiple areas, because sun damage doesn't just happen on the face, it's the neck, the chest, the hands. But in addition to that, you're probably going to see a significant improvement in skin quality, texture, and tone because of that anti-aging benefit that you might do. So I've got some patients that will have BBL because they might have issues with redness or rosacea, so a skin problem. But I also have some patients that will just have it as part of their anti-aging maintenance. So they'll just do 2 sessions a year, just essentially to keep that collagen and other skin aging genes boosted as much as possible. And Tallulah, we were talking about this before we started, but I don't know if any of you watched the Brian Johnson documentary on Netflix, the guy that wants to live forever, the multi-millionaire. And if you actually do watch it, you will clock in one of those treatment rooms, there is actually a BBL Heroic device in the corner. So that's clearly one of the devices that he is using for exactly that reason, because of the benefit that that paper demonstrates.
It's so fascinating, and I wonder how much the rest of the body can be targeted with this. If the progression of what's happening in laser development is very much here, we talk about the décolletage, we've all sort of talked about how things reach our nipples more in the way that they didn't used to in skincare, and certainly the hands as giveaways, but where is the rest of the body possibly able to be targeted? Obviously not so much pigmentation can necessarily pick up or be seen because there's presumably a thicker dermis, so it just isn't so apparent. But are we gonna get some sort of full body laser to rejuvenate in terms of youthfulness as well as pigmentation, all of us?
Yeah, so this is a good question. I think with all the knowledge that we've got online and events like this, everyone's pretty good about sunscreen these days. Certainly the people that come and see me. And they're very good about putting sunscreen on their face. They're not so good necessarily about putting sunscreen on the back of their hands or the neck, or when they're on holiday, necessarily thinking about other body parts, or if you do sport outside and you're a keen runner and you're running in shorts, you put your sunscreen on your face in the summer, but you don't think about your legs. So all of those other areas are still vulnerable to getting that sun damage. So it's not unusual, for example, for us to treat a face and then somebody will say, oh, my neck looks a bit different now. And then you treat the neck, and then it's like, oh, now I can see the sun damage on my chest. So the truth is that treatments like this can be done on all body areas where there is sun damage, but also if you want to rejuvenate the skin, because there is that additional data with BBL, you can help rejuvenate the quality of the skin in those areas. Because the other thing that we know is as we get older, we will lose collagen, we will lose elastin, we will lose hyaluronic acid in all the layers of our skin, all over our body.
Yeah, knees, elbows, all of those kind of giveaway places.
The whole lot.
I'm just wondering when there's going to be some sort of technique and machine. Obviously, everything is very handheld, and it's manually conducted for, you know, the care and attention, the specificity of the place. But do you see that there could be anything that is kind of, I guess, a little bit more robotically enhanced, where you don't just have a person with 2 hands able to target a wider area?
I think probably that will be the future, but I think the closest that we've probably got to that now is something like the BBL device, because it is so automated. So just to give you some idea, if you're not used to using IPL devices, and I've used other IPL devices in the past, so I can compare them directly. Generally speaking, what happens is you have a treatment area, and then you do a pulse, then you do another pulse, then you do another pulse, and you just keep moving along the body. It's quite a slow, quite a laborious process. With the newer devices like BBL, so BBL Hero, which is older than the Heroic, what that allowed you to do was just glide the handpiece and it would fire much more quickly. So you could treat large surface areas very, very quickly. But the beauty of the Heroic is it's actually almost like a computer laser. And what I mean by that is you literally put in the energy settings that you want, you put in how fast you want that laser to fire, you put in what percentage you want to overlap that laser, and then you just move the handpiece and it will consistently give you the same overlap and the same shot in a very, very quick manner. Now, if you have a human doing that, there is no way a human hand is going to be as accurate as a preset that you stick on a computer device. And I can say that. I've done a lot of IPL, and I've done a lot of IPL with an old device, but I can tell you, if somebody knocks on the door, or if a patient's a bit uncomfortable and they pull away, that overlap will not be consistent, no matter how good I am, no matter how experienced I am. But if I put that on the machine, if I keep moving it, it will fire. If I stop moving it, if somebody interrupts me, it just stops firing.
Yeah.
So at the moment, that's probably the smartest technology that we've got, which also then makes it incredibly safe. Because if you go to laser clinics in general, the device has to be good, but the person firing the device has to be good as well. So you might have a lot of variation between individual practitioners. You might have been to a laser clinic and you're like, oh, I really like that person. And then you go in another day and you get a different person. You're a little bit disappointed that you didn't get the one before. But if you can automate the devices, what you also create is essentially the same treatment every time.
That makes good sense. Then the other thing is there anything that can, obviously it's frequency, cadence, how often, like working out, like going to the gym, like your cleansing routine, how often you actually have a treatment. Now, is there anywhere within smart technology, or I guess the impact of a laser, that we're lazy as human beings. We want a one and done. We want this one thing that's going to do it, or just simply far less cadence. Is there anything that kind of links to that, or not really?
I mean, the truth is, it depends, number one, on the concern that you're trying to treat. So if we stick onto the idea of like photo aging, photo damage, so you get changes in color, so you get changes in tone, so those are the reds and the browns, but you also get changes in skin texture. So this is where you start noticing things like pore size becoming more prominent, fine lines becoming more prominent. So if you are trying to build collagen in the skin, so texture, you will need slightly different treatments to if you're trying to tackle color. The second thing is, how much downtime does the person having the treatment want? Some people are a bit like, I would rather just have lots of gentle treatments and then I can walk out of here, no one knows I've had anything done, it hasn't broken the skin. And some people are the total opposite, and they're like, I really don't want to do very many of these. I'm happy to take a week off. I will go for the strongest treatment that you've got. I'll do everything you tell me in terms of wound care, and I will accept that there's quite a lot of looking after my skin I will have to do in the subsequent 7 days. So I don't think there is a one size fits all. I think you've got to figure out what the issue is, what the patient wants, and also what their budget is.
Absolutely. So through that, and I want to open it up to a floor in a second, is there anything at home devices that are at all as effective?
So I'm going to start by saying home devices are really popular. They've become really popular post-COVID when we started doing a lot of our beauty treatments at home rather than wanting to go somewhere. One of the issues with home devices in general is they will not be as strong as something you get in the clinic. And the reason for that is a very simple one. It's a safety issue. You cannot fire the same degree of energy or fluence or joules through something at home, because what if a child picks it up and blinds themselves? So there are safety restrictions around that. So my general take on this is it's better to have a clinic treatment than have a home device. Now, if you are somebody that is already maxing out your lifestyle, you're wearing your sunscreen, you're doing all of those other things that you should be doing, and you have money to spend, and you want to use a home device as part of that, and as part of your self-care routine, it's your 20 minutes to yourself where you feel good and you feel like you're looking after yourself. I am not against that.
Okay.
If the question is clinical efficacy, I think there is a question mark.
Okay, there we go. Now, who has questions? Pigmentation lasers, let's go.
A bit off topic, but I'm really curious to know at what age you should start putting SPF on your children, like daily. And it may not be an answer, but...
Yeah, do you know, there's like a public health answer, which is everyone should wear sunscreen. It should always be factor 50 and it should be all throughout the year. And the problem with that is it slightly lacks the nuance. You know, in this country, we are at a very northerly latitude. If your child is going to school in the dark and they are coming home in the dark and they are indoors all day, they're not seeing very much UV and they're growing and they need their vitamin D. So my actual answer to that is it's a bit nuanced. They're doing sport outside between the months of March to October. Yes, they should put sunscreen on before they go outside. If they're going to be outside for more than 20 to 30 minutes and they're going to get sunlight, yes, they should be wearing sunscreen. If they're naturally very fair-skinned, yes, they should be wearing sunscreen. But it's definitely not a one-size-fits-all as we're led to believe. Like everything, there is a little bit of balance, and I think there is a concern that we're going too far the other way, where we become so obsessive about it, at times that we don't even need it.
So you do have like pigmentation and damage from the screens, because it's like blue
Good question.
So if you look at all of the clinical studies that have been done on blue light or high energy visible light, the amount that you actually get from a screen is so small in comparison to what you would get from sunlight. So from a practical point of view, again, it's a real good marketing technique, but the data doesn't back it up. Do I think you should wear a sunscreen that's going to give you blue light HEVR protection anyway? Well, you may as well, because you're going to be outside at times whilst you're wearing it as part of your routine, so there's no harm. But do I think we need to be worrying about blue light from screens? No, I don't. So if you're working from home, inside, you're not going anywhere, I wouldn't necessarily be concerned about that.
What are the best topical treatments to get rid of acne scarring topically at home?
So when we think about acne scarring, we can either be talking about changes in colour, so that could be the dark marks or the red marks that are left behind from acne, or we could be talking about indentation in the skin. So if we're just talking about marks, okay, just colour, because no home treatment will get rid of the indents. But from a colour point of view, the first thing, again, I will caveat that with is over-the-counter skincare can only do so much. And the reason for that is it's a cosmetic, it's not a drug. A prescription item would be a drug. And the definition of a cosmetic is it cannot change the structure or function of the skin. So if something is really not meaningfully changing the structure or function of your skin, what is it doing? So if you did nothing at all to post-acne marks, in about 18 months, they would go away. So option one is conservative management. But if you assume that that's not what we're going to do, what kind of ingredients can help? The kind of ingredients that can help are things like azelaic acid, and you can get that into concentrations of up to 10%. There are online prescription services that will give you concentrations of up to 20%. So that's one option. The second option is using products that contain vitamin A. So retinols, retinaldehydes, or prescription tretinoin can also help speed up skin cell turnover. So they will also, over time, help get rid of the marks. Now, that's not a bad idea because those vitamin A agents also have anti-acne activity as well. So not only will it get rid of the marks, but you might also find it's a good maintenance treatment from an acne perspective also. So those would be my two top choices. Then there's a whole list of other things. So further down the list, I would put things like niacinamide, topical tranexamic acid, vitamin C. They are far less potent. So I think it's much more important that people can use a vitamin A, their retinoid, consistently, and their azelaic acid consistently, and then maybe once a week if the skin is very oily, a salicylic acid wash just to help exfoliate the skin. So those would be my top three.
Are there any particular brands you'd recommend sort of in the different ranges, so the low range or the higher range?
So I don't work for any of the brands I'm going to recommend. These are just, if you come to see me in clinic, this is just what I would say. So from a vitamin A point of view, I would say the gold standard would either be adapalene or tretinoin, which is prescription. If we put prescriptions aside, I do like the Medicate Crystal Retinal. That's got a retinaldehyde in it. I find that sensitive skins tolerate that quite well, and retinaldehyde data for acne is pretty good. It's better than retinol. From an azelaic acid point of view, I like the Paula's Choice 10%.
Anyone else? Yes.
Thoughts on natural skincare, minimise, resveratrol, and how effective do you think they are?
So I think they have a role, but I would never say they would form for me the backbone. The backbone of a routine, of a good skincare routine that will take you through kind of pigmentation, anti-aging, all the rest of it. You cleanse, you moisturize, ideally a vitamin C in the morning, a vitamin A at night, and maybe an exfoliator. Then I see the things like a niacinamide and a resveratrol as a nice to have. So let's assume that you've nailed the rest of it and you are successfully using all of it. Then you might want to add in a niacinamide. A niacinamide will help with skin brightening and oil production. But the truth is your vitamin C and your vitamin A would do that anyway. So the question is, do you need it, is probably what I would say. And then resveratrol, it's an antioxidant. Vitamin C is an antioxidant. But if you did want to use an additional antioxidant at night, maybe you could add that into your nighttime routine, so you've got the antioxidant ticking you over. So nice to haves rather than essentials.
What's the basis of using the vitamin C in the morning? Can you use, if you're just using one, could you use it at night?
They have slightly different purposes in the skin, the vitamin C and the vitamin A. So the vitamin C, number one, it's an antioxidant. So it's really good at helping your skin protect itself from sunlight. So that's a good reason to use it during the day, because sunlight and ultraviolet light on the skin will create oxidation, which can contribute to skin aging. So that's why we normally recommend vitamin C in the morning. There is also data that shows that vitamin C works synergistically with sunscreen, so another reason to stick it into your morning routine. And then the third thing is it's also a skin brightening agent, so from that point of view, you'll get that additional benefit, but the main reason we tend to go for it in the morning versus the evening is just for those additional antioxidant sun protection benefits.
Something I thought of, I just want to bring it back to the laser again, is are there any limitations in BBL, and are there things that you think are being adjusted, again by way of could it be smart or whatever it could be, as just future projection of where this could go, of limitations that you experience in clinic?
I think if we talk about risks, every treatment has a risk, you know, and I think it's really important to take that on board. This is not like, I don't know, just getting your nails done. It is still a light-based treatment where you are dumping heat into the skin and you are still causing damage to the skin to get a clinical response. So the potential downsides or risks of treatment that you need to be aware of. Well, number one, there is a risk of burning the skin. So you mustn't go into the sun 2 weeks before or after a treatment, because if you're tanned, that's much more likely to happen. There is a risk that the skin may blister. These are not common things, but you know, the problem is medicine is not perfect. There's no 100% safe treatment. So you need to go in with your eyes open to that. The second thing is with the treatments, it's not a one-off treatment. You often do need to do a course of treatment. And for example, broadband light, you can do 2 to 4 weeks apart. A course is 3 to 4 weeks. But it's not permanent. You're still getting older. You're still getting sunlight. You know, the only way to avoid sunlight is to go and live in a cave. No one should do that because no sunscreen 100% blocks out sunlight. So once you've got your skin to where you want it to be, you're still going to need to do maintenance on top of that. So those are a group of limitations with BBL. It comes with a risk. That's why you go to someone who knows what on earth they're doing. We don't use the same energy settings for the face versus the neck versus the body. There is a little bit of nuance to how those treatments work. The second thing is broadband light is not suitable for every skin type. So broadband light is not suitable for black skin. There is a risk with black skin. There is also a risk with dark Asian skin. You have to be a little bit more careful because there is more melanin in the skin and the laser sees melanin. So there is a risk of burning the skin. So one has to be careful with that as well. So that's another thing to be aware of, that you might choose a different laser treatment to BBL. There are other treatments that are colorblind. So there's another treatment called Clear Silk, which fires deeper into the skin, which is very good at evening out pigmentation. So again, that's kind of more knowledge of the practitioner to kind of pick, that's the right thing for that person, that's the right thing for that person. And then the final bit of your question was just projecting into the future, what to expect. Well, I wonder if there will just come a point, like you said, where it won't actually be a manual person doing the treatments, and there will just be an arm that's able to just move up and down, and whether or not licensing restrictions might change that you can get effective home devices that work at a lower energy setting that might work. There currently are home-based IPL treatments that people use for hair removal, for example. And some of them work pretty well. And the question will be whether or not there will be a device like that that may be able to be used in the future. So I think there's a lot to see. Laser technology has moved on a lot in the last 5 to 10 years.
And finally, do you think that it's anything that could treat skin conditions, obviously the way that it treats acne? Could it treat things like eczema or psoriasis? Is there sort of evidence to suggest that that could be supportive?
You have to be a little bit more careful with inflammatory skin conditions that are dry, like eczema and psoriasis, because if you're not careful, what you can do is you can trigger a flare-up of those. That said, there are other inflammatory conditions like acne and rosacea, which you can use BBL to treat. So again, here, it depends on the diagnosis as to whether or not that treatment would be safe or not.
Okay, fabulous, thank you. Yes?
Difference between two protocols, BBL Hero and Forever Young.
So Forever Young is the one where you do the maintenance sessions of 2 a year, and you use slightly different treatment sessions to...
It's more stronger.
It's not stronger, the energies are slightly different. So if I was going to treat a rosacea patient, for example, with BBL, I would probably be using a higher energy setting, and I would also be combining it with a second device called Clear Silk, which is a 1064 nanometer laser. If I was purely doing it for skin aging maintenance, so there's nothing wrong with the skin, then the Forever Young protocol, it's a slightly lower energy setting that you would use because there's nothing primarily wrong with the skin. You're not trying to target the reds that you would get with the rosacea, or if you've got an acne patient, the blue light that you would want. So the settings are slightly different.
So here in this case, better if you have some problems with the skin.
It depends on what the issue is. So if you want skin aging, your practitioner or your provider will use different settings. If the issue is acne, they would probably use different settings. And if the issue is rosacea, they would use different settings.
Anti-aging anyway.
I mean, it depends if you want to group rosacea and acne as kind of anti-aging, if that makes sense. Do you see what I mean? Because I always like to think of it, and maybe it's just the way that my brain thinks.
For me, this is not anti-aging. It's just like healing some problems. For anti-aging, for me, it's different settings.
So that's exactly right. So skin and health and skin and disease. That's exactly right. So I would, in my head, I see it as skin and health, which is what you're talking about, the Forever Young, or skin and disease, which is then a rosacea protocol or an acne protocol. Yeah.
Amazing, Dr. Marto. Fantastic.
Thank you.
Thanks, everybody. Bye.